Good morning students. Today we are going to discuss the attachment on the mandible. In my previous video I discussed the different parts of the mandible. So I will just give a brief account of that information. That mandible has a body, it has two rami. Each ramus has a coronoid process, it has a condyloid process which has head and neck. On the inner side there is a pterygoid fovea. Now coming to the different attachment. First we will discuss the attachment on this ramus portion. Now to the coronoid process the temporalis muscles are fibers are inserted. To the pterygoid fovea which is present on the inner side of this neck of the mandible, the lateral pterygoid muscle is attached, that is insertion. Then coming to the inner side, on the inner surface of the mandible, ramus of the mandible near the angle, this rough area is receiving the insertion of medial pterygoid. Now the lateral surface of the ramus of the mandible is receiving the fibers of the masseter. Now coming to the different ligament attached in this region. Now on the inner side of this ramus of mandible there is one mandibular foramen is present. Above that mandibular foramen the bony projection lingula is there. To this lingula portion the sphenomandibular ligament is attached. Now coming to the body portion. Now this is the body of the mandible. This region, that is incisive fossa, which is present in this region, is giving origin to the mentalis fiber and the orbicularis oris fiber. So this incisive fossa. Now coming more laterally, there is one line on this body of the mandible which is known as the oblique line. The oblique line in the upper portion is giving origin to the buccinator, and in the lower portion it is giving origin to the depressor anguli oris and depressor labii inferioris muscle. Now on the inner side of this body of mandible there are four tubercles, that is superior genial tubercle and inferior genial tubercles. The superior genial tubercles they give origin to the genioglossus muscle, and lower genial tubercle they give origin to the geniohyoid muscle. Now coming more laterally, there is another line present on the inner side of the body extending up to this ramus which is known as the mylohyoid line. To this mylohyoid line it is giving origin to the mylohyoid muscle. Now coming to the inferior surface. On the inferior side in the center there is fossa is present which is known as the digestive fossa on each side. This digestive fossa give origin to the anterior belly of digestive muscle. Now to the base of mandible, to this region the platysma muscle is attached. Now coming to this region which is coming more laterally near where the body is meeting the ramus portion, this is known as the angle of mandible. This angle of mandible is giving attachment to the stylomandibular ligament. So these are the important muscles which are getting origin from here. But if we discuss more detail of that, this mylohyoid line at the posterior edge is giving origin to the fibers of the superior constrictor too. So superior constrictor muscle is attached here. Then pterygomandibular raphe is attached behind the third molar tooth. So on this mylohyoid line, just behind the third molar tooth. So these are the important attachments on the mandible. Now what are the different important nerves which are related with the mandible? I told you in my previous lecture, but I am just giving a repetition of that. First is the mental foramen. Through this the mental nerve and vessels they come out. On the inner side, this is the mandibular foramen. Through this mandibular foramen the inferior alveolar nerve and vessels they pass. And just above this mandibular foramen, this region has close relation of the inferior alveolar nerve and vessel along with the maxillary artery. But what are the structures passing through the mandibular foramen? That is inferior alveolar nerve and vessel only. But once they are passing through it, before that it gives one nerve, that is nerve to mylohyoid, which is running in this groove portion, which is present below the mylohyoid line. So this groove has a relation of mylohyoid nerve and vessels. Now the medial surface of this head of the mandible has attachment or relation with the auriculotemporal nerve. Now this notch is present between the coronoid process and condylar process. To this notch, which nerve is related, that is mesenteric nerve. So the mesenteric nerve and vessels they are related over here. Then behind the third molar tooth, that is on inner side of this ramus of mandible. So here on the posterior side of this mylohyoid line, so which important nerve is related, that is lingual nerve. So these are the important nerves which are related with the mandible. Lingula on the inner side, lingual nerve on the inner side, inferior alveolar nerve on the inner side of the ramus, mylohyoid nerve and vessels on the inner side of the ramus, auriculotemporal near the neck of mandible, mesenteric nerve in the mesenteric, this mandibular notch, and mental nerve and vessels, they come out through this mental foramen. So this is all about the attachment of mandible. Thank you very much.